Good afternoon and welcome to the St. Clair County Daily Briefing. I'm joined today by Director Herb Simmons with County EMA, and we'll get right into today's numbers. So today in St. Clair County, we have tested a total of 104,372. That is an increase of 981. Positive test results, we have 8,354, which is an increase of 45 new positives since yesterday. Those are males and females under the age of 10 and to their 80s. That brings our daily county positivity rate to 4.6% and our 7-day county rolling percentage to 5.9%. For the negative test, we have 96,018 negatives. And unfortunately, today we are adding one additional death, bringing our total to 214. That was a female in her 60s, and she did have underlying health conditions. And as always, our thoughts and prayers go out to her family. For those that have completed their IDPH required 10-day isolation period, we are at 7,596. For state totals, the state has tested 6,696,257. Positive test results, they've received 339,803, which is an increase of 3,629 since yesterday. For statewide deaths, there's been a total of 9,192, which is an increase of 27 since yesterday. For hospitalization numbers, we'll start with those that are currently in St. Clair County hospitals. We currently have 41 COVID-19 related patients, and 2 of those patients are on ventilators. For the region, we have 76 COVID-19 related patients, and 5 of the patients are on ventilators. Next, we'll go into our congregate living facilities and outbreak status, and that's the facilities that include residents and staff with 2 or more COVID positive or COVID-like illness at the facility. We're only going to announce the changes. So Mercy Rehab and Care Center in Swansea has 17 cases and 0 deaths, which is an increase as 1 death. And St. Paul's Home in Belleville has that was an increase of 1 case. 1 case at Mercy Rehab. And then St. Paul's Home in Belleville has 60 cases and 15 deaths, which is an increase of 1 case. Now I'll turn it over to Director Simmons for the updates.
Thanks, Brian. And we want to tell Sam thanks. She's over at the health department, still working, and she was able to get us the numbers put together. So, Sam, we appreciate, as we do every day, the work you do keeping us straight. We'll go into the zip code report. 62201 had an increase of 3 up to 264. 62203 had an increase of 1 up to 242. 62204 had an increase of 1 up to 167. 62206 went up by 2 to 507. 62207 went up 2 to 264. 62208 went up 2 to 487. 62220 goes up 3 to 649. 62221 goes up 2 to 768. 62223 goes up 4 to 515. 62226 goes up 2 to 879. 62239 goes up 1 to 134. 62254 goes up 1 to 284. 62258 goes up 2 to 210. 62260 goes up 1 to 165. 62269 goes up 4 to 676. And you heard Brian give the report on the daily county positivity rate, 4.6, which is down a little bit from yesterday, which is always good news. The 7-day rolling at 5.9 stayed the same as yesterday. And we're happy to report that the regional positivity as of October 14th remains the same as yesterday at 7.0. And that number is arrived at from the state by our surrounding counties and what they've been doing. And so we'll go through them. Bond County came in today at 8.1%, which is down. We really appreciate the help there. Clinton still high at 14.2%. Madison came in lower today at 3.6%. Good job, Madison. Monroe really came in good. We appreciate all that help, 1.9%. Randolph still high at 10.0%. St. Clair, 3.1%. And of course, Washington really stepped up to the plate, and we really want to thank them. They came in with 0% today. So I think what this shows, Brian, is when we're working together, those numbers will be reflected in a few days out.
In about 3 days, when we see as you mentioned, that rolling regional positivity's got a 3-day lag on it as of October 14th today. So in 3 days, when we see those numbers hit, we expect to see a slight decrease in that regional positivity. Now, the key is we need to continue that beyond today. It's a good step in the right direction. And the key to that is increased testing and practicing those 3 W's.
Exactly, and I think that just shows that this works, what we've been talking about all week long, that we needed the help from our region, the entire region. We've been saying that we need that help. If we were standing alone, we'd be okay, but unfortunately, we're in a region that gets counted. So that's why it's so important that these other counties step up like they did today, and it's really, really going to help us, I hope.
Absolutely. And one thing I want to talk about, we had somebody send us a message this morning with a question about a CDC or what they believe to be a CDC document that someone had shared, and we were quickly able to do some research on that and prove that it was not correct. And it kind of leads me into this statement, and we've talked about this before, but when people are looking at guidance and documentation and what they should or shouldn't be doing, you've got to make sure what you're looking at is factual. This person sent us a CDC document that said you shouldn't wear N95 masks, you shouldn't wear surgical masks, and you shouldn't wear cloth masks. Well, quickly you can go to the CDC website and see that that's not accurate. And I'm thankful that this person asked the question versus what others have been doing and just blindly sharing that. And unfortunately, when you share something like that without checking it first, you run the risk of other people sharing it. And then quickly we wind up having a lot of problems when people say, oh no, masks aren't supposed to be worn anymore. And really that's our best defense right now.
Well, and we've, 218 days we've been talking about this, and I wish we could say when it was going to come to an end, but we don't know that. If we did, we'd really be popular, I'll tell you. But the mask is our best defense. We've had those physicians on here, the medical experts. We've had the CEOs from the hospital. Everybody has said the same thing, that the mask is not a 100% guarantee.
No.
So for those of you who were on the page last night that made that comment, I agree with you. Probably the first time and the last time I'll agree with what you said, because we have said that. It's not 100%, but it's the best defense we have. And along with the social distancing, washing your hands, wearing a mask, that is what can help stop the spread of this. One other person that follows the page quite a bit used to put the pictures of the sheep on there with the mask on. And then some of the staff members here would respond and say, well, look, even the sheep are smart enough to wear a mask. Well, that took about a week for him to quit posting that. Now he just posts a picture of the sheep. So even he knows that wearing a mask, and the sheep knows that that's his best defense. So please wear the mask, wash the hands, watch your social and physical distancing, and the outer counties and what we're doing here, Team St. Clair, we can get these numbers down. Stayed at 7% today. It's not good, because if we get to that 8, and if it gets up there for 3 consecutive days, then the mitigations will probably go back in place. But let's just hope that 7 starts going down. And Team St. Clair, again, we appreciate each and everything you do. Keep continuing to spread that word to your friends, your families, your neighbors. Share it. Let them know. And you can say, well, maybe they're tired of hearing it. I'm tired of saying it. So please, if we get everybody, we get those numbers down, we can all take a little break. And remember, there is 214 people that are taking a long break. They don't have to worry about this, and it's a shame because it didn't have to happen. Those people don't have to worry about wearing a mask, watching their social distancing because they're by themselves. And we need to stop that. 214 of our county residents aren't with us. Statewide, 9,192 people have lost their lives just in the state of Illinois. So please, everybody be a part of the solution and not a part of the problem. We'll be back with Cindy in just a few moments to translate this into our Spanish communities, and then we'll be back tomorrow for our question and answer session Sunday afternoon. Thank you and have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and lock